So enhanced recovery after surgery is one of the most exciting changes in surgical care that's happened in the last 100 years of surgical care. And it's the idea that a pathway of different parts of care can be implemented to improve how surgery patients do. There are things that we can do before, during, and after surgery that fundamentally change how patients recover from surgery. And those things include components like we've always made patients unable to eat or drink the night before surgery. And so they come into us dehydrated and starved, which is never how you would want to come into a marathon. So now we encourage patients 2 hours before their operation to take in a carbohydrate beverage, much like someone would take in before a race. And this hydrates them, provides them the nutrition they need to be ready for the operation. And then during the surgery, we try to balance how much fluid we give. You wouldn't want to drink too much or too little fluid during a marathon, both would be bad. We do the same in surgery because too much fluid can cause problems with how the sutures close in whatever surgery you're having. Too little fluid, of course, causes dehydration and poor perfusion to the surgery you've had, and it may not heal properly there either. And then after surgery, the key is getting up, moving, pooping, and eating. And so we want patients out of bed right after surgery. We want people eating within hours of surgery, at least starting to drink and then ultimately eat, because the longer we don't feed, the more the bowel goes to sleep. And we want people able then to start pooping, actually, because that's one of the major things that lets people go home after surgery and gets them out of the hospital. And so ERAS incorporates targets in our care that address all those issues. And some of those things even include we use less opiate painkiller medications because that slows the gut, causes constipation, causes vomiting. So we use more regional anesthetics, things like epidurals and spinals, so that people can recover faster, get less medication that keeps them in the hospital and causes complications ultimately afterwards. And so it's a whole structure of pathways that we're really focusing on. And what we hope, one of the key aspects of the talk at the Digestive Diseases Week will focus on is how we in particular deliver nutrition within these pathways. We'll talk about the pathways themselves, but we really are realizing that how we treat the gut and how we deliver nutrition, whether it be in the month before surgery or the month after surgery, plays a role in outcome. And we just had guidelines come out around that, national guidelines that tell us that we really need to be better at recognizing malnutrition in our surgical patients. We know that 1 in every 3 patients in the hospital is malnourished when they get admitted. And in fact, people having major GI surgery, 2 out of every 3 patients coming for that surgery are malnourished before they have the operation, and no one is checking right now. And so we hope there's a day when there will never be a patient in the United States or anywhere in the world that has surgery when they're malnourished without A, being checked for it, and B, having it treated. So no one should ever have surgery without being asked if they have eaten enough, if they're eating more than half their meals, whether they've lost weight or not, or other signs of malnutrition being checked. Because when you're malnourished, you're not ready for surgery, you're going to have more complications, and we can treat it. We can give you simple things to make it better. And so we believe that's true both before surgery and that this care needs to continue after surgery. And this is a major change in how all of us, whether we're surgeon, anesthesiologist, gastroenterologist, or anyone else, thinks about our patients, particularly in gastroenterology, where you have patients like with inflammatory bowel disease that come in with severe malnutrition. I think all of us should be expected to do better for our patients, and implementation of ERAS really pushes all of us as care providers to, in every part of the care around the time of surgery, really do the right thing, whether it's before, during, or after. That we have to pay attention. We have to be sure our patients don't come in malnourished or dehydrated or not ready for the operation. We have to be sure we do things right in the operating room, and then we have to be sure we do all the things that get them up, moving, eating, and pooping after the surgery so they can go home and return to the life they came to us to give them in the first place.